is my pleasure to introduce you all to Jeremy Cohen. He received his bachelor's in science at Tulane University in cell and molecular biology, got his PhD from Tulane in cognitive neuroscience, did a postdoctoral fellowship at Stanford University in the Center for Interdisciplinary Brain Sciences Research in the Psychiatry Department at the School of Medicine. Dr. Cohen's research interests are on emotional processing and the neural systems that underlie emotional experiences. His research has focused on brain structure and function that relates to anxiety and depression in developmental populations, as well as psychosis in adults. His current research focuses on the interaction of dynamic functional brain networks and systems related to emotion regulation, attention, and health benefits of mindfulness meditation. Dr. Cohen's neuroscientific understanding of meditation is combined with and informed by nearly 20 years of personal meditation practice from numerous traditions. And so, without further ado, I hand over the presentation to Dr. Cohen.
All right, thanks so much. All right. Thank you so much. Good morning. Definitely thank you to everyone for tuning in. A special thank you to Bob Schwartz for inviting me this morning, as well as Laura Redwine for helping to organize this presentation. And yeah, I think let's all take a good deep breath in and out, returning to the present moment so that we can explore this interesting topic, this timely topic on the neural mechanisms of mindfulness meditation. It's been expanding in the literature over the last 10 to 15 years. There's certainly been consistent health benefits as well. So what we'll do is I'll introduce a bit about meditation in general, offer a framework of mindfulness meditation specifically, and based on that framework, kind of take a peek into some physiological evidence that is reflective of that framework. We'll look at some broader effects on the brain as a result of meditation practice. And then I'll zero in a little bit more on some of the work from my lab, which will focus us in on the default mode network and look at some supporting evidence from other labs. And then we'll do perhaps a rather quick rundown discussion on various health benefits, and we can maybe take a look at some future directions. So some of us may be familiar with meditation, others not as much. There are many different meditative traditions, and popular culture has really kind of lumped all of these different forms and practices together under a singular umbrella. And an individual saying that they're going to do a study on meditation is akin to an individual saying that they're going to do a study on sport, as though all forms of sport are equivalent. And the literature really does a poor job of distinguishing different forms of meditation, frequently lumping different practice styles together, and not even doing well to distinguish between sitting-based practices, which would include mindfulness meditation, and movement-based practices. In this talk, we are going to focus on sitting practice, as we're focusing on mindfulness meditation. And sitting practices are typically point of focus based, but of course, what varies across those different practices is what is the point of focus. And the literature essentially has coalesced around 4 broad categories that we can look at meditation from. There's focused attention, meditation, which is a single point of focus. It's usually in the body and it's usually the breath, although it could include things from outside the body like a sound or an image. But in traditional meditation practices, it's usually the breath, and usually the breath at the nose, but sometimes as well the expansion, contraction at the chest or belly. Basically, the meditator is just focusing on the sensations coming from that point of focus. If attention deviates in any way, they get lost in a wandering thought, they come back to that point of focus. They come back to the breath. Um, Open monitoring is also a point of focus, except now the point of focus is open. The meditator is free to shift attention to different bodily sensations occurring throughout the body, throughout the mental experience as well, noticing how these different sensations are arising and passing away. And there can be some different variations to techniques on how to explore those embodied experiences. Vipassana, which is my practice orientation at this point, as well as mindfulness-based stress reduction, MBSR, fall into this open monitoring category. And this is really where mindfulness meditation resides as well. We'll take a look at that. And for those, interested in MBSR, familiar with it, it was developed by Jon Kabat-Zinn following his practice in Vipassana in the 1970s with S.N. Goenka. There's other practices as well, compassion-based, which is more oriented towards cultivating compassion towards self and others. And this includes things like metta, Tonglen, or forgiveness practices. And then there's mantra-based practices, which includes things like kirtan kriya and transcendental meditation, where an individual is focusing on a mantra word or sound to cultivate a sense of expanded consciousness. Although I'll offer the disclaimer that I know and have very little experience with mantra-based meditation practices. So again, our approach here is going to be focusing a bit more around this open monitoring type. And then as we continue to consider that's meditation, what is mindfulness? Well, we're all sitting right now, or standing in my case, but are we fully aware that we're sitting or standing? Are you aware of the contact points with the chair or your feet on the floor? Perhaps you maybe just adjusted your posture a bit, but why? Thich Nhat Hanh says that when we're not aware of our neutral sensations, those that are neither pleasant nor unpleasant, they often can become unpleasant. And then you or I shift our posture to try to make that discomfort go away. We're reacting to that discomfort. We're trying to control it in some way by changing our posture. And this is your entire experience. This is my entire experience. It's derived from the body. It's derived from these sensations that are moment-to-moment signals that, of course, then become an information flowing river that gives us a window into this changing nature of our experience in any moment. And because a sensation can only be experienced in the moment, it's, these transient signals really can only be experienced right here and right now. And that's what mindfulness is. It's paying full attention to these sensations in the present moment and bringing us back to the embodied experience. Now, that term mindfulness meditation has been tossed around. It gets tossed around in the literature. It's tossed around in popular culture as well, again, as encompassing this large umbrella of different practices, but it's actually a very specific uh, Buddha teaching on the four foundations of mindfulness as a very specific and strategic, pragmatic, and scientific approach to observing our embodied perceptual experiences. And it proceeds as a practice of remaining mindful that is fully aware on a moment to moment basis of the arising and passing nature of the body, the sensations of the body, the positions of the body, the fact that I'm standing up or that I'm sitting down or I'm lying down, or actions of the body and the various parts of the body, as well as feeling tone, this pleasant, unpleasant, or neutral nature of our sensory experiences or mental experiences that I referenced before. And then, of course, mental states themselves, which are also arising and passing. This includes thoughts, beliefs, images, but also other affective states like joy, anger, frustration, boredom. All of those would fall into this category of different mental states. And then objects of mind, or all of the percepts that are contributing to those mental states. And all of these experiences are indeed constantly changing. So if mindfulness meditation consists of that practice, that also means that mindfulness meditation is not other things. And I see a lot of confusion when I talk to people, or things that are written about meditation or mindfulness meditation, that can be confusing. And there's misconceptions that meditation is about achieving specific states, and it's not. It's not about necessarily experiencing calm or valuing any particular experience over others. I've had many conversations about individuals saying, I really can't meditate because I'm not good at clearing my mind. Well, that's not how that works. The mind produces thoughts the way that the mouth produces saliva. It just does it on its own. So it's not about clearing the mind. And oftentimes, especially for newer practitioners, when we sit down and we begin to look at the body and we look at these sensations, the brain can actually throw a bit of a temper tantrum and throw up a whole frenzy of thoughts to distract us. And this is so reminiscent of my first overnight silent retreat, where there were so many thoughts and frustration and self-judgment and self-doubt, and everybody else was having an easier time, or they were much happier. And it was pre-pandemic, so I had a roommate, and I became convinced that my roommate was annoyed by me. And then by the end of the retreat, of course, I was able to talk with my roommate, and we shared a lot of appreciation for each other and the time that we had spent together. And then he revealed that he also had this false belief that I was annoyed by him. And then it hit me like a ton of bricks that not only does my brain make up stories, but it does it in a way to play tricks on me. And of course, once I became aware of that, it didn't happen as much at subsequent retreats. Of course, my brain found new ways to play tricks on me, but that's probably another talk altogether. So meditation really then becomes very much not about controlling the experience in any way, and not becoming attached to whatever the experience is. And these aspects of either control or judgment really just reflect greater personalization. I want something, I need something, I'm bad at something, I'm annoying someone, I'm frustrated. Those are aspects of our experience, but indeed, mindfulness meditation is really just becoming aware that those experiences are occurring. So mindfulness meditation then engages a whole host of perspective taking skills, and they're all sort of coalesced around this idea that the experience that I'm having, the experience that I'm witnessing, is an impermanent experience. And by watching my physiological experience, I'm able to understand this inherent property of impermanence that, directly through the experience of the body, that my physiological experience is impermanent, and indeed the environment is impermanent as well. And we can all think of this cognitively, but it's something else to experience that on a much deeper level. And of course, this involves and engages focused attention. We need to be aware of the bodily sensation, and we really begin to observe the experience of the body and not judge it in any way. And this is where we begin to learn that our experience is indeed impersonal, and it is just arising and passing, and that we're just trying to watch it just as it is, which then brings in greater acceptance instead of our conditioned reactivity to our experience. So we begin to learn equanimity and getting out of the habit patterns of clinging to pleasant sensations or avoiding unpleasant sensations, like shifting around potentially with our posture in a chair, or as I'm standing. They seem like small reactions, but these are all of the small reactions that do make up our experience. And this is very much in line with James Lang theory. I can think of an example of, walking in the park with my dog in the morning, and it's, the sun the light is coming up, and the birds are singing. I'm aware that I'm walking, so I'm mindful in the moment, and then I hear this rhythmic sound, and then I can just step to the right, and it turns out that this runner is passing me to the left. But in an unmindful moment, I could be in the exact same place and sort of lost in thought. Sure, I'm using my eyes to not trip over anything in a very automatic kind of way, but I'm not really attending to the environment. I'm thinking more about what I need to do later, or what I'm going to eat, or something like that. And then all of a sudden, there's this rhythmic sound, and I flinch, and the same runner goes past me to the left. So in this moment, I can engage new strategies like patience. Okay, I wasn't in the moment. Let's come back to this. This is the experience that I'm having, and then curiosity. I can explore what's happening. Okay, my heart is racing. I'm feeling some more intense vibrations, some sensations in my legs. That's not comfortable. I don't like that. Okay, well, bring in some more kindness. Okay, this is just the experience that's happening right now, connecting with the breath, connecting with the environment, and beginning again. And that's really the persistence of the practice. And in this way, we begin to recondition the brain and the nervous system to engage these perspective taking skills over those reactive patterns where maybe I just get very frustrated with myself that I'm not in the moment. And then I'm kind of angry at the runner, or I'm angry at myself because, I was thrown off of whatever my thought focus was. So this is where our habit patterns can drive our behavior in unwanted directions. So I've referenced this notion of arising and passing. So then, is there physiological relationship with, or evidence of arising and passing? Of course, as a neuroscientist, I'm gonna look to the nervous system, and I can think no further than an action potential, which has a rising phase and a peak point that lives for a very short period of time, and then a falling phase. But a single action potential does not make up my entire perceptual experience. So what about many action potentials? And this kind of looks like arising and passing and arising and passing. Of course, just the action potentials don't make up my experience either. There needs to be the communication between neurons. And when I look at synapses, I see arising and passing here too. The arising, opening of calcium channels, the influx of calcium, the release of neurotransmitter, the binding of neurotransmitter to a postsynaptic neuron, postsynaptic potentials. All of these look like the arising of these different physiological events. And then, of course, they have their own, they stay around for some period of time, but eventually calcium channels close, the influx ends, the release stops. There's mechanisms to clear the neurotransmitter, binding ceases, and the postsynaptic potential stops. So all the way through our physiological experience, and not just in the nervous system, of course, throughout the entire body, we have these physiological mechanisms that are happening. They're occurring for some period of time. They pass away, and they shift to another state. And there is indeed this permanent nature that is pervading our physiological experience. Of course, that also raises an interesting question. If we look at this from the point of view of sensations, which sensation is the self identity? And this becomes an interesting question that we'll consider as we move along. So as an individual gains practice in meditating and these different perspective skills, what changes are actually occurring in the brain? Well, from a wider perspective, there's quite a number of different structural changes that we can see in the brain in different areas that impact meta-awareness, both exteroceptive and interoceptive, sensory experiences, memory consolidation, motion regulation, but also intra and interhemispheric communication. And there's an extensive literature out there that reviews, some of the effects of meditation. Of course, we don't have time for all of that here, so I'm just recounting, I think, some fun snapshots that are interesting about the brain changes that we see. And here's another interesting study that actually shows a shift in structural connectivity, the actual shifting of white matter patterns from the right insula away from the precuneus area, which is involved in a host of different different functions rather, with regards to environmental perception, but also memory incorporation as well, autobiographical information. It's a part of the default mode network, which we'll talk about more, but we actually lose this right insula to left precuneus connection and actually increase right insula to left insula. And this is after just 5 months of training. And that training period included only about 12 hours of guided meditation practice and only 10 sessions. So it doesn't take that long and that much practice to begin to have significant impacts on the structure of the brain. And it's really interesting about the left insula is that it is a parasympathetic autonomic regulatory region. So that'll be really interesting as we, hold that in mind as we kind of think about some of the health effects that we see from meditation practice as well. And speaking of structural brain changes, is anybody here aging? I'm aging. I think we're all aging moment to moment. It turns out that meditators and meditation offers a neuroprotective effect. There's an algorithmic approach to assessing the age of the brain in comparison to an individual's chronological age, called brain age. And what they found was that meditators have, on average, 7.5 years younger brains compared to their chronological age. And even more interesting is that the biggest gains in brain age actually occur after the age of 50. So this is a really exciting, and potentially neuroprotective effect of meditation practice. And if you're not sold on the brain age metric, there was a study that was done in mild cognitive impairment, and the brain age metric was 90% accurate in predicting who amongst that sample would go on to develop Alzheimer's disease. So this is a robust assessment. So really exciting, brain anatomical changes that we see from meditation practice. There are also exciting functional changes that occur as well. And if we look at this, graphic from a review study, and we zoom out, and we can remember those different four categories that I introduced at the beginning, we can see that meditation in general is really good for the brain, and that all of the different categories that I mentioned have, and exert positive impact on brain function. But if we sort of zoom back in to open monitoring as an approach, that mindfulness meditation approach in the blue dots, you will see that this approach, with the most expansive perspective taking skills development, also coincides with the widest array of brain functional effects. And among those, we can see different aspects in across the three main neural networks. When we sort of divide the brain into main overarching neural networks, we have a task positive network, which is exactly what it sounds like. These are different parts of frontal cortex and perhaps parietal lobe and attentional systems that are engaged when we're involved actively in doing a task. There is the default mode network, which, kind of as it sounds, is a collection of brain areas that is active when an individual is awake. They're alert, but they're not doing anything. So it's now the idling state of the brain. And there is the salience network, which is the interchange network between the two, and it actually helps to direct traffic between those two systems. And when we look at those blue dots, actually in that open monitoring category, the mindfulness meditation type affects all three of those systems, whereas the other forms of meditation only exert, much more focused impacts. So I do want to focus in a little bit more on that default mode network. And I did mention this tricky, sticky spot earlier of self and self-identity. And we can think back to my meditation retreat experience where I was telling myself that I was annoying my roommate, and others were having a better, happier experience. But at the same time, it's also possible that they were just taking greater amusement in the interesting thoughts that their brain was serving up, which I was certainly able to do at subsequent retreats. The default mode network is, that network that tends to be active in individuals when focused on internal mental state processes, including self-referential processing, self-judgment, autobiographical memory retrieval, imagining the future, and also interoception. So it's interesting that, especially the last one, interoception, which would be something that would be engaged with mindfulness meditation. But we can see that each of these functions does have a beneficial value. But if there's overrepresentation of the default mode network, that could become problematic. And just ask anyone that is dealing with depressive symptoms, anxiety, PTSD, chronic pain, mild cognitive impairment, Alzheimer's disease, amongst others, because all of these populations have shown aberrant functionality or functional connectivity within or between the default mode network and other areas. So there is some sort of aberrant functionality of the default mode network in all of those different populations. The literature around the default mode network is exhaustive, and again, not the purpose of this talk, but it is interesting because this is an area that I've spent a little bit of time working with in my own lab. And due to some infrastructural reasons, my lab tends to work primarily with archival data. And one of those data sets is a publicly available data sample from the NKI Rockland sample. So this is the NKI Institute, a psychiatric health institute as part of the state of New York. And I'm not going to go too in depth in the whole data set, but suffice it to say, this is a large scale cross-sectional sample of brain development, maturation, and aging with participants ages 6 to 85. I think that there's like 1,300 subjects that are in this cohort. It was all funded by NIMH. And it's a very phenotypically rich sample as the individuals underwent semi-structured diagnostic psychiatric interviews, as well as collecting genetic information, other biometric health information, neurocognitive measures, advanced multimodal neuroimaging, behavior measurements as well. So a lot of self-report measurements. And of particular interest in this sample, there's a subsample of about 125, 130 subjects that also did a real-time fMRI neurofeedback task, in which those participants were instructed, amongst other things, to down-regulate their default mode network on command. And they did this in 30, 60, and 90-second periods. And they were basically just shown an image like this. So basically, the researchers were just recording and aggregating from those different default mode network brain regions. Like I said, they were aggregating that into a value. That value then became this odometer needle on the screen, and the subject was either in the focus condition or the wander. In the focus condition, this is when they are trying to downregulate their default mode network. There was an upregulation condition, but we didn't analyze those. And basically, based on the aggregate of blood flow activity in those regions of interest of the default mode network, that came out as a needle point on the screen for the participant to respond to change their strategies or what have you, to try to alter their brain function. What was also interesting was that buried amongst all of this phenotypic data was a singular question of interest to us. On a scale from 1 to 10, how would you rate your meditation experience? And not surprisingly, most of the participants did categorize themselves as having very little meditation experience. However, the more meditation experience that an individual perceived themselves to have, and thus rated themselves on this 1 to 10 scale, the better they were at downregulating their default mode network on command, specifically during the 90-second trial periods. So it probably took them a little bit of time to figure out the strategy, which is why the effect maybe didn't show up in the 30 and 60-second conditions. They weren't given any guidelines in terms of how to downregulate. They were just asked to do that. So that was one interesting result that we see, is that these experienced meditators, self-reported as it were, are indeed better at downregulating their default mode networks on command. We looked into the same data set, analyzing the resting state data, and using that same 1 to 10 metric on how well they perceive their meditation experience. And even at rest, so now with resting state imaging, that fun fact of, 20% of the oxygenated blood is going straight to the brain. So the brain is always active. So as long as these individuals, they're awake, their eyes are open during these resting state periods, and we're just recording what is the blood flow during this period. They're not instructed to do anything other than to stare at a fixation cross. So they can be thinking about what they need to do when they get out of the scanner. They could be thinking about the noises in the scanner. They could be thinking about how they have to use the restroom. I mean, who knows? They could be thinking about anything. But even in that state, the baseline function of these individuals' brains, and the more meditation experience they reported having, we saw functional connectivity increases. So increased coupling between the right frontal eye field and dorsolateral prefrontal cortex in the right hemisphere, and inferior posterior parietal cortex also in the right hemisphere. Now, all three of these regions are involved in that task positive network. They're sort of frontal attention related regions. And this will be an interesting result as I kind of talk about the next piece of archival data that my lab has been working with. And this comes from a previously published study by Hassenkamp and colleagues that is now over a decade old, in which they got together a very small group of 14 experienced meditators. And by experienced, I mean the person with the least amount of experience had 17 lifetime hours of meditation. The most experienced person did have over 3,000 hours. So it was a pretty wide range, just under half. So 6 of the participants had more than 1,000 hours of experience, and the other 8 were under 1,000 hours of experience. And when they put them into the scanner, this is now a focused attention task, a focused attention meditation task, rather. So they had them in the scanner. I think this was for 20 minutes. And they basically said, just follow your breath. Just focus on your breath. And when you are aware that your mind is wandering, press the button. And when they did that, they were able to create, as you can see here, different conditions in very small windows. So basically, the 3 seconds prior to the button press, they called mind wandering. In the 3 seconds around the button press, they called that awareness of mind wandering. 3 seconds later, they called that shifting attention. And then finally, 3 seconds after that, they determined that the subjects had now shifted their attention fully back to the breath, and they were back on task. And they use that strategy to compare those conditions to see, this was just looking at peak activation, to see what peak activation was different in those different periods. So the individuals are in the scanner, they're pressing the button. So if we go to the 3 seconds prior to the button press, and this is the mind wandering phase, it's exactly what you would expect to see. A whole bunch of that default mode network activity that I referenced earlier. And then, of course, during the awareness of mind wandering period, it's similarly what you would expect, in that they showed salience network activity in terms of the insular cortex and anterior cingulate. And then in the next 3 second period after the button press, you can see that the shifting attention period very interestingly activated right dorsolateral prefrontal cortex and right inferior parietal cortex. The same two regions that my lab was able to show in resting data is more strongly connected to frontal eye field at rest based on an individual's self-reported meditation experience, which means that not only is meditation effect on the brain so robust, that's so robust that we can find results just by asking people a crude question on a scale from 1 to 10, how good do you consider yourself as as a meditator, or how much experience do you have? But it's also reproducible. So we're seeing, even at baseline in the data that I showed from resting data, something that looks akin to individuals having sort of a higher, network engagement to activate this attentional shift, this intentional shifting, meaning that maybe those individuals who are having more meditation experience are raising their baseline to shift their attention back on task. Uh,
Jeremy,
yeah.
you froze for a couple seconds, or maybe we
Oh,
did. Somebody froze.
okay.
Okay.
Where did you lose me? I guess my internet has gone unstable. What was the last thing you heard?
I think it was the dorsal. Yeah, when you were talking about your lab being very similar to the
Okay.
findings looking at
Okay.
executive function. Yeah.
Okay. Yeah. Thanks for letting me know. So yeah, let me repeat that part. So in the shifting attention phase in the Hassenkamp data, they found the dorsolateral prefrontal cortex activity and inferior parietal in the right hemisphere. And what I was saying was that this very much mirrored the functional connectivity result that we saw in the resting state data from NKI that was just around an individual's self-report of their meditation experience. And that indeed seems like a pretty crude measure, and it's already fairly robust that we're able to show functional connectivity that is associated with that self-report measure of meditation experience. But I think it's even more interesting in light of the manner in which it reflects this attentional shifting component that is emerging in the meditation task from Hassenkamp, maybe even suggesting that with increased meditation experience, that those meditators are increasing their network resilience, their capacity to shift attention back on task. That would then be generalizable across the tasks that they're doing, and not necessarily just to a singular task that we might see with other forms of cognitive training. They do also show dorsolateral prefrontal cortex, during the sustained awareness phase as well. Excuse me. And then what my lab is really working on with this data now is a more functional connectivity approach. So investigating these different condition periods to see how they are different from each other from a network perspective, as opposed to just peak activations. And then also looking at the functional connectivity as it relates to self-reported stress severity symptoms and their lifetime hours of meditation experience, since we have that. And what was really interesting in this data set, the more hours that an individual actually had, significantly lower stress symptoms measured by the Calgary Severity of Stress inventory. So we're really interested in how that data shakes out. And kind of looking at some of the broader literature, again, in some of this interaction between the salience network and the default mode network. This is kind of an involved study. I'm just going to kind of boil it down really quickly. They had experienced meditators, they had non-meditating controls, and they had a bunch of different conditions. They had an active task condition, which was sort of a word perception task. They had an eyes open rest period, they had an eyes closed rest period, and they had brief meditation periods. And I think if we really just kind of focus in on this figure to the left, where they separate out the different groups and the different tasks, what we can really see is a level of synchrony between parts of the salience network and parts of the the default mode network in the meditators that is not replicated in the non-meditators. So what we see is that during the meditation task, they are very much down-regulating both the anterior cingulate and the precuneus. And again, in terms of some of the sensory integrative aspects that the precuneus is involved in, it's much more in environmental stimuli. And because meditation is more about observing the inner experience, there's this downregulation of both of those regions. And you can see it's so robust that it's a global effect for the meditators compared to the controls, regardless of task, that downregulation is occurring across the entire study for the meditators compared to the controls. But what's more interesting is that during the active task, and because I said that the precuneus is involved in this, processing of sensory information, potentially for cue reactivity, there's this mutual upregulation of activation in both the anterior cingulate and precuneus. So now there's a bridge between the salience network and part of the default mode network as it pertains to the task that the individual is doing. And the meditators are engaging that network in that way. Non-meditators are not. And that lack of engagement in the non-meditators maybe says that there is some lack of resiliency that's coming in terms of the interaction of these networks. Because again, the precuneus, while it's involved in some of that sensory integration, it's also involved in episodic memory retrieval and effective responses to pain and autobiographical information. So it's possible that the non-meditating controls may be more susceptible to this network being hijacked in a negative way, which again would be reflective of things that we see in anxiety or depression, etc., where repetitive thoughts begin to gain greater salience. And just to kind of sum this all up, between some of the data from my lab, some of the work from Hassenkamp, that study that you just saw, and there's actually this study as well that worked on this with meditation and mindfulness meditation specifically. And there is this unique bridge that begins to form between the salience network and that dorsal precuneus area, so areas that are integrating sensory information for its cue oriented value, and then passing that information along to task positive network regions. So basically, meditators, mindfulness meditators, become strengthened in this muscle to engage more intensely with the task, to stay on task, and also get back to the task if a distraction arises. So this is a bunch of fun stuff with regards to the brain. But of course, we need to run through some of the obligatory health benefits. And of course, as you may be familiar, there are many different benefits. And this isn't even necessarily all of them. And I'll try to run through this quickly because I do want to give us some time for some questions here at the end. We were just talking about, meditation, improving this ability to stay on task and shift back to task with any sort of distraction. So you can see on the left, this is a study with meditators with more than 3 years of experience. This is just a Stroop word color task. They make fewer mistakes overall, and they make particularly fewer mistakes on incongruent trials when the color and word are mismatched. So on the harder trials, they make even less mistakes. So they're staying engaged. And similarly, on the right, this is experienced meditators with after going on a 3-month meditation retreat and then doing a dichotic listening task, assessing attentional blink. And those experienced meditators have much faster reaction times, and they are more accurate. They are hitting their correct responses at a higher rate, having fewer false alarms, and showing greater sensitivity. Again, cue reactivity, which we just mentioned. Of course, improved cognition, even in mild cognitive impairment, following training, meditation training, cognitive and daily functioning improved following that training, as well as at a 1-year follow-up. And that 1-year follow-up was progressively better the more the individuals practiced on their own during that year. Long-term meditators, again, similarly improved behavioral results, Stroop, NBAC, visual search tasks. There's a whole bunch of effects on stress and physiology. Individuals following meditation training showed increased natural killer and B cells, better quality of life measurements, lower blood pressure, and decreased heart rate. So things that were related to parasympathetic nervous system activation, if we reference back and think about that increased connectivity from right to left insula. And also changes in self-report stress measures and actual cortisol reduction. And cortisol reduction that continues to decline over an entire year following their meditation training. Also reduction in inflammatory T cells. And again, reduction in those T cells over the year following training. In a separate study, they also showed that training was related to increased telomere length. Remember, I talked about that increased structural connectivity between right and left insula and parasympathetic regulation. So meditation is also associated with a dramatic spike in low frequency heart rate variability that is very much absent when an individual is just sitting quietly. And other studies have kind of repeated this effect, and these oscillations also coincide with breath rhythms, respiratory rhythms, and also brain function, suggesting that there is a synchronization of brain cardiovascular and respiratory rhythms. There's decreased pain and spasticity following meditation training. And of course, study after study after study, there's improvements in mental health, decreases in depression, anxiety. It was even shown that individuals following MBSR training, women following MBSR trainings, were more resilient and less negatively impacted by hot flashes. So that's a really significant effect of this observation of the bodily experience. Kind of just trying to wrap this up. We talked about all the different meditation traditions, and of course, my focus on mindfulness meditation. The mechanisms are beginning to gain some clarity, and this approach of mindfulness meditation does seem to offer the broadest set of perspective taking as well as the broadest set of benefits. and it's really about retraining both those perspectives and brain functions. And now I'm interested in your questions. I know with a very small amount of time, but also curious in ways in which we can find to work with one another in supporting meditation practice, potentially working with med school students, providers in your clinics, and as well as potentially with patients. Thank you so much.
Thank you, Gary.
Thank you very much. So we are going to take some questions. I'm gonna have to step out, but yes, so we'll be able to share slides, handouts. Is that gonna be okay with you?
Yeah, that's fine. Yeah.
Can see everything. Okay, great.
I have a question.
Yes, please.
One thing, Jeremy, that was a great talk, a really great talk. And
Thank you.
so one of the things I was struck by is that the shifting your attention back, there's almost a way in listening to you, I realized that it's actually not a bad thing. Like we always think, oh, there I go again.
Yeah.
But actually, there's a strengthening.
Yes.
Can you comment a little bit more about that?
Absolutely. That's a great question. And it's one of the other common misconceptions. It is very much that strengthening through returning back to the task itself. And Robert Wright is an evolutionary psychologist. There's a great story with this. And he describes this in his first silent meditation retreat. He goes to the teacher and he says, oh, I'm having such a hard time. I keep noticing all of these thoughts. And the teacher says, this is great. You're noticing thoughts. And that's the practice. I mean, that's the thing that we can get so misconstrued with meditation and the types of experience that are associated with it, and calmness and, a quiet mind and those sorts of things. And that does come with time, and those experiences happen. I've had plenty of those. I've had plenty of experiences sitting, and it's very frustrating, and my body won't settle, and I don't want to do it. And, and I had a lot of difficulty with that earlier in my practice, coming to Vipassana and really working with equanimity to just sit and observe and continue and come back to it again and again has really been a huge, huge benefit, because it is building that resiliency, exactly as you referenced.
Right.
Jeremy, can I make a comment that
Sure.
it seems to me that the act of refocusing one's attention is actually similar and probably part of the mechanism of how we learn. For example, if you're learning a language, repetition obviously is the thing that builds the neural pathways that create the linkages, so that that thought. So when you're associating a particular thing with a new word, if you repeat it multiple times, so I would assume it's a very similar mechanism in terms of how our brains function.
Yeah, absolutely. I mean, I 100% agree with that in terms of that repetitious action, but also I think, again, as we look from some of the data, the way that it's specifically incorporating specific cues, right? As you kind of referenced in your example about words and the word sounds, it's this increased cue sensitivity and awareness of that with the repetition and staying on task, coming back, doing it again, repeating it again, doing it one more time. Okay, let me practice that one more time. Let me practice it in this environment, in that environment. And yeah, absolutely. It very much is related to learning.
So Jeremy, do you have a PowerPoint presentation or something that you would give to patients in terms of introducing them to the whole mind-body experience?
I'm still working on new presentations all the time, and absolutely, that is a project that I am working on right now, as I'm working with my own teacher training certification, in explaining mindfulness to beginners, and explaining different tools, and designing courses as well to actually help to offer training in the practice itself. But I would certainly be happy to put together presentations if there's specific topics that we would want to discuss and explore.
Yeah. I would love to work with you on doing something like that we could develop for patient classes at the Osher Center.
Yeah.
I think that would be extraordinarily important. And I'll just give you an example. So most of us who have been to medical school understand the structure of the brain.
Mm-hmm.
But I think that for the average person who's not taken neuroanatomy,
Sure.
they really don't get it. They don't understand the
Right.
different components. And I think that in an explanation and an education program for mind body, I think it would help people to understand what the different components of the brain are actually responsible for and what their functions are. And I think that would be a great way of pulling them through in terms of getting to understand how the mind body experience works.
Absolutely. And I have, I have little snippets of that sort of information from other talks that I have given in the past and would like to update in terms of, basically these sort of different general systems of attention and movement and sensation and bodily sensation, visual sensation, and basically how those different parts of the brain are really just playing off of each other, and trying to assert dominance over each other, that actually dictates our experience. And I'd be happy to definitely explore ways in which we could best try to present that information to connect with patients.
Great, thank you.
We have another conference starting now, but
Okay.
one of the things that I would love to entertain with you too, building on what you were saying, we had offered MBSR trainings here for several years, and getting people to commit to an 8-week training program, and it sounds like you're working on your own training program, was extremely difficult. And yet the benefits are so great, and so widespread, physiologically. So perhaps when we meet again, we can brainstorm about what's the languaging that would allow us to market it in such a way that it would hook people and, to commit.
Right. Well, yeah, I mean, the one thing is for me, it's sort of informing people up front. The practice is simple, but not necessarily easy, in that, we are trained, these reactive, patterns are trained, and we don't like discomfort. And when we sit, it tends to, at least early on, it brings up a fair amount of discomfort. And I've sat through a fair amount. And there was a great quote, and I don't remember, this a longtime practitioner who really recounted as she was struggling at the end of life with cancer. And she was so remarkable as she was dealing with all of that pain and sadness and fear. She recounted how grateful she was for all of that, all of those sits. It really does give us so much resilience and a different perspective of, of those experiences. So I think sort of, offering that reality to individuals, maybe a little bit difficult in a slogan. I'll have to kind of think about that. But in terms of information, guiding them to let them know that experience is okay. It's very normal. It is part of being a human in a human body. This is the experience that human bodies have. And then beginning to not take that personally, that it's just this human body experience. It's not my experience. I don't own frustration. I don't own pain. This is a common feature to all humans, and finding ways to work with others and to listen. Oh, this person's also having this experience. They're also struggling in this way. And there have been studies done that have shown that, online meditation training can be useful as well. So I don't know if that could offer something that would be a lighter lift for people, as well as maybe doing something that's a little bit shorter, something that could even be as short as 4 to 6 weeks or something like that.
And still be able to see efficacy.
Yeah, at
Yeah.
least enough to, orient individuals to the practice, to the experiences, and hopefully to engage their curiosity, because that's really the big thing in shifting their perspective towards curiosity. So building that equanimity so that they're reacting less, and building that curiosity and kindness to the experience at the same time. And if we keep repeating that, coming back to Bob's point, and really repeating that, I repeat that in teaching to really emphasize, yeah, this is the thing, this is the thing. And it's just sort of building up that persistence to keep working with it.
Great.
Great. Thank you, Jeremy. We will definitely stay in touch.
Absolutely. Happy
Very
to come
much
back and meet again and talk anytime.
Absolutely.
Thank you.
Thank you all. Have a great day.
Bye-bye.
That was great.
Yeah.
Was it?